From our messages, I think we would like to say to the people of our province, we are in the middle of the third wave. And what happens every week is of great significance about whether the pandemic is gaining more momentum or is slowing down. We are not seeing evidence of compliance, of better compliance. We are not seeing evidence of these messages are not getting out there that the pandemic is everywhere. We're now picking up the reports of infections, including family-level infections. Those reports are coming from almost every part of the province. And it is winter. We are very concerned. It is winter and it's cold. It's worse when there is inadequate supply of power and electricity. So I want to deposit this again. We are deeply concerned also about, so there's been load shedding. We are deeply concerned about the impact of it in our battle against COVID-19. Water cuts has been a matter of great concern. The water cuts have impacted on our fight against COVID, especially. The water cuts have not only been experienced by our healthcare facilities, but also the communities in Johannesburg. This morning, I spoke to the CEO of Rand Water, and this is just an illustration that the provincial government has been working with the city to do everything to address this issue of water, the water cuts and the inadequate water supply. As I say, for our hospitals, it compounds the problem. Inadequate when the hospitals don't have sufficient water supply in the middle of a pandemic that needs so much water. We say people should wash their hands, but the healthcare system cannot operate without adequate water supply. And this morning I was assured by the CEO of Rand Water that the system breakdown that has happened in Johannesburg has been restored or resolved. So the impact of water cuts on our health response to COVID-19 has been terrible, and we can't afford water cuts again in our province. But we are not in control of water supply. This has to be made clear. We are not in control. So what we are doing is using disaster management regulations. We are going to complement the supply of water, and I want to really thank the NGO that has just come and provided substantial relief, and they've also done something very, very important by digging the borehole at Rahima Musa. We really gift of the givers. We really thank them for the intervention. Provincial government department of COCTA, which is also responsible for helping us to intervene on water supply, is also looking at the period we are in. June is the most crucial period in the Gauteng province. Just looking at the evidence, if all these interventions happen later in July, that will be too late. If Charlotte Maxeke reopens much later in July, that will be too late. If we don't get constant supply of water now, in the middle of the third wave, when the numbers are increasing and the pressure is building on the system, to get this help later in August, that will be too late.